Masseter muscle. Masseter muscle is the very important muscles of the muscle of mastication. It is the strongest muscle of the jaw. It is also the second strongest muscle in the body, in the human body. This muscle is seen in mammals so that they can chew the plant food. Okay, so this is a masseter muscle, very important muscle for the muscles in the muscles of mastication. The word masseter is a Greek word, or it is derived from a Greek word masasthai, which means to chew. Development, this muscle is derived from the mesoderm of the first pharyngeal arch. Okay, so if you look at this this diagram, this is the masseter muscle. It has two fibers, superficial fibers and deep fibers. The origin is from the zygomatic arch. This is the zygomatic arch. It arises from the lower and the deeper aspect of the zygomatic arch, and then it splits into two fibers, superficial fibers and deep fibers, and both the fibers are inserted into the ramus of the mandible. Now we'll discuss in depth. Origin of masseter muscle. It arises from lower and deeper aspect of zygomatic arch. Lower and deeper aspect of zygomatic arch. Insertion. It inserts into the ramus of the mandible as two fibers, superficial and deep fibers. Superficial fibers, they run downwards and backwards, whereas deep fibers, they run vertically downwards, and they both merge together and they enter the ramus of the mandible. Action, always remember one thing, that origin pulls the insertion. So origin is from zygomatic arch. It will pull the insertion, means it will elevate the mandible. Elevation means closing of the mandible. So origin will pull the insertion, it will elevate the mandible, as well as it will also protrude the mandible because of the placement of the fibers. It will make the mandible move forward. So elevation and protrusion are two action of masseter muscle. Nerve supply is by mandibular nerve, to be more precise by the masseteric branch of the mandibular nerve. So nerve supply is by the masseteric branch of mandibular nerve. So origin, insertion and action and nerve supply are very important points to be written in the in any muscle. Now coming to relations, superficial relations of the masseter. Superficial means above the masseter muscle or lateral to the masseter muscle. If this is the masseter muscle, what are the superficial relations we have? Number one is the zygomaticus major muscle. The first is zygomaticus major muscle. Then we have parotid gland. Second is the parotid gland. Then we have three nerves. Number three is the zygomatic nerve. Fourth is the buccal nerve, and the fifth is the mandibular nerve. Okay, then we have transverse facial vessel, transverse facial artery and transverse facial vein, and then we have facial vein. So we have these 7 superficial relations of masseter muscle. Relations of masseter muscle. So deep means when you go deep inside the muscle, the first thing you see a temporalis muscle, you see buccinator muscle, buccal pad of fat and the buccal nerve. So temporalis muscle is the first muscle and is, you see in deep relationship, and temporalis muscle is another muscle of mastication. This muscle is attached on the coronal process and the anterior surface of the ramus of the mandible. Okay, and then you see buccinator muscle, buccal pad of fat and the buccal nerve. So these are the relations which are deeper or medial towards masseter muscle. So in the masseter muscle, we have seen the development of masseter muscle. It is derived from the mesoderm of the first pharyngeal arch. We have seen the origin, it originates from the zygomatic arch. We have seen the insertion, it is inserted into the ramus of the mandible, supplied by the mandibular nerve. We have seen the action is protrusion and the elevation of the mandible, and we have seen superficial and deep relationship of the masseter muscle.